Good afternoon, folks. Today's B, today's discussion B is about um, aged care nursing. Okay, key takeaways: early recognition. Nurses often detect signs of end of life decline in residents up to a year before death, making them pivotal in quality care planning. Systematic barriers. There's this systemic barriers, limited resources, staff shortages, and time constraints hinder consistent palliative care. Care influences, flawed processes lead to fragmented and reactive care delivery. Folks, when someone's passing away, you want to give them as much care as possible. You don't want something missing from their care, first of all, and you don't want to disrupt their care when their care is streamlined and seamless. Okay, staff shortages and limited constraints hinder consistent palliative care. Care influences care inefficiencies, flawed processes lead to fragmented and reactive care delivery. Training gaps. Many nurses lack comprehensive education in end of life protocols. Research scope. The study, led by Founders University's Research Center for Palliative Care, involved interviews across 15 aged care homes in 3 Australian states. Demographic pressure. With Australia's aging population, over 1/3 of deaths for people age 65 plus occur in residential aged care, highlighting the critical need for systemic reform. Policy memorandum. Okay, reforms include mandated care hours and 24/7 access to registered nurses, emphasizing the shift toward better quality and understanding of care policies. This this is a compelling snapshot of how deeply attuned nurses are to residents' needs and how systemic gaps could undermine their capacity to deliver empathetic, holistic care. Curious to explore how similar trends play out in the U.S. elder care policy. Okay, here are the key systemic barriers impacting aged care nurses based on the document's findings. Systemic challenges in aged care nursing, limited resources, chronic staff shortages stretch nurses thin, especially during end of life care. Time constraints prevent consistent attention to residents involved in evolving needs. Care, care inefficiencies, fragmented workflows lead to reactive rather than proactive care. Bureaucratic policies or bureaucratic processes hinder timely responses and coordinated care interventions. Training gaps. Many nurses lack formal education in end of life and palliative care protocols. Training discrepancies contribute to uncertainty and clinical decision making. Oversight and policy delays. Regulations often lag behind actual on the ground needs, undermining autonomy. While reforms like mandated care hours and 24/7 nurse access are in motion, implementation remains uneven. These barriers point to a broader structural issue. Nurses are deeply attuned to residents' needs, often sensing end of life decline up to a year before it occurs. Yet the system isn't optimized to support that insight. Would you like would you be interested in exploring how similar gaps affect US nursing homes or comparing solutions across countries? The systematic barriers aged care nurses face, unlike understaffing, fragmented care systems, and inadequate training, don't just affect resident outcomes, they take a real toll on nurses' well being too. Here's how: emotional and psychological strain, moral distress. Nurses often sense when residents are nearing end of life long before formal recognition is yet systematic systems inefficiencies can prevent them from acting compassionately, and compassionately. That disconnect fosters guilt, frustration, and emotional fatigue. Burnout, consistent pressure with limited support leads to exhaustion, uh, cynicism, and a reduced professional satisfaction. Isolation. Without adequate interdisciplinary collaboration or staffing, nurses may feel alone in decision making, especially in emotionally charged moments. Cognitive overload. Decision fatigue. Navigating ambiguous care pathways, especially without clear palliative protocols, forces nurses into repeated high stakes judgment calls, reactive workflow. Fragmented systems mean they're often uh, firefighting rather than planning proactivity proactively, which undermines clinical confidence, reduce professional growth, limited training support without continuing education in palliative care. Nurses can feel ill equipped, creating a sense of professional stagnation, devalued insight. Nurses' early recognition of decline isn't always integrated into formal planning, so their clinical intuition may be overlooked or dismissed. Altogether, these factors weaken nurses' retention, dampening moral morale, and erode the holistic uh, holistic ethos of aged care. It's a systematic issue, one that speaks to the need for truly nurse informed reform. Would you like to explore what reforms are showing promise in mitigating these effects? We could even sketch out a frailty aware model where nurses' insights are central. Several reforms are gaining traction to support aged care nurses' well-being, recognizing that workforce resilience is essential to quality care. Here's what the document outlines and how some of those ideas are taking shape. Emerging reforms to support nurses. Mandated care hours. Policies now require minimum staffing levels and direct care hours per resident, aiming to ease workloads and ensure timely time for holistic interactions. 24/7 registered nurses access. Continuous access to trained nurses help shape clinical responsibilities and reduce emotional burden on lone staff during critical situations. expanded training and education. There's memorandum toward comprehensive palliative and end of life care education, giving nurses confidence and tools to act on early decline detection. Interdisciplinary collaboration, strengthening collaboration with physicians, aligned healthcare workers, and social services supports shared decision making, reducing isolation and moral distress. Well-being programs, though not detailed in the document, global trends suggest integrating mental health support, peer mentoring, and reflective practices into aged care settings. Why it matters. These reforms are rooted in acknowledging nurses' early recognition skills and emotional labor, not just their clinical duties, by addressing systematic stressors and empowering nurses as care navigators. Aged care settings become more humane and sustainable. Want to go further and explore how memory friendly environments could amplify these reforms, or what nurse led innovations are gaining policy support in the US or elsewhere. Memory friendly environments aren't just design features, they're powerful reinforcers of aged care reforms, especially when it comes to supporting nurses' well being and amplifying quality care. Here's how they align beautifully with the reforms you've been exploring. How memory friendly housing, how memory friendly design supports nursing reform. Reduces cognitive load on nurses. Intuitive layouts, color coded zones, and clear signage make navigation easier for residents, freeing nurses from repeated redirection tasks and minimizing stress. Predictable routines built into the environment reduce behavior related crises, allowing staff to focus on therapeutic care instead of consistent troubleshooting. Enhances enhances interdisciplinary coordination. Purpose build Purpose built spaces for team meetings and quiet reflection fosters collaboration and emotional debriefing. key to, key to reducing morale distress and building resilience. Smart housing integration, wearable alerts, or sensor driven monitoring can suffice. Early changes in frailty or cognition supporting nurse led clinical decisions creates emotional safety, familiar furnishings, outdoor access, and spaces for meaningful interactions offer calming sensory input, reducing aggression in residents and emotional strain in staff. Residents with dementia experience fewer behavioral escalations, which lowers risk and emotional fatigue for caregivers. Support, supports training and uh, retention implementation. Retention implementing memory friendly environments while transformative isn't without its complexities. Here are some of the key challenges that tend to surface: structural and logistical constraints, retrofitting existing facilities. Many aged care homes weren't designed with cognitive accessibility in mind. Renovating to include initiatives, layouts, wayfinding cues, and sensory sensitive spaces can be costly and disruptive. Budget limitations. Creating or modifying environments with therapeutic gardens, small lighting, or sensor in, intelli- integrated systems often focus often face finding shortfalls, especially in publicly funded institutions. Under underappreciated clinical design, misalignment with care models. If architects and designers aren't collaborating with clinical teams, the environments may look pleasant but fail to meet practical caregiving needs. One size fits all pitfalls. Not only residents experience in memory decline in the same way, designs that don't allow personalization might inadvertently cause confusion or aggression. Workforce adaptation gaps, training defects. Staff need guidance to use spiritual design effectively. For example, how to leverage environmental cues for acceleration, or independence. Change resistance, shifting from traditional layouts to more autonomy promoting spaces requires a communication change, which may face institutional pushback, regulatory and privacy tensions, smart tech concerns, sensor enabled features like fall detection or AI assisted monitoring may raise privacy concerns, especially around data ownership and consent in dementia population. Policy fragmentation and regulations often lag behind innovation without clear standards. Providers might hesitate to invest fully in memory friendly designs. Okay, guys, so that is B for you. I'll be back on shortly with C in a bit. Give me a bit for C, please, and I'll be back on with you. For now, Gator Wellness, take care, folks.